For this short video, I thought I would instruct a little bit on the cavities of the body, using my own body as an anatomical model. By the way, using your own body is a great idea because you always have it with you. It's like having your own cheat sheet all the time. Just for clarity's sake, I've also decided to include these pictures that may help you understand where these are in a more kind of, I guess, three-dimensional sense, rather than just seeing the outside of someone's body. So don't be too surprised when you see these little images along the way. So the human body has several cavities. The first one I'll start with is at the front of the body. Remember, front, or ventral is the word for front. This is the ventral part of my body. And the cavity that contains the organs in my chest, the organs in my stomach, and the organs in my pelvis, all of those areas make up one big cavity called the ventral cavity. All of the parts you see here in yellow, those are the ventral cavity. The ventral cavity is then further divided, first by the diaphragm, which is at the bottom of your chest. It's the muscle you use for breathing. And that diaphragm separates the organs in your chest from the organs in your stomach and pelvis. The cavity above the diaphragm is called the thorax, so the chest cavity is the thorax. Everything you see in yellow now is part of the thoracic cavity, the thoracic cavity. The cavity below that diaphragm is called the abdominopelvic cavity. Everything you see in yellow now is called the abdominopelvic cavity, the abdominopelvic cavity. Let's go down to the abdominopelvic cavity down here. Above my belt, you might think, that's where my digestive organs are, also my pancreas and a few other organs. Those are abdominal organs inside the abdominal cavity. So that's the abdominal cavity. Everything you see in yellow now is part of the abdominal cavity. This is the abdominal cavity. And in your head you might think below my belt, that's where my pelvic cavity is going to be. Now there's no nice dividing line between the abdominal cavity and the pelvic cavity like there is the diaphragm between the thorax and the abdominopelvic. Rather, it's a matter of what organs you're seeing. So if you see intestines, stomach, etc., then you're in the abdominal cavity. If you see the urinary bladder or reproductive organs, then you're down in the pelvic cavity. And once you get to the torso model, when you see it opened up with all of the organs out of it, you'll really see the dividing line for the pelvic cavity. It really does have a better dividing line than I'm kind of saying right now. The yellow shaded area at the bottom, that is the pelvic cavity. The pelvic cavity. Let's go back up to the thorax. Within the thorax, you also have a few more cavities. You have lungs on the right side and the left side. Each of those lungs is inside of its own cavity. These are called the pleural cavities. On the person's right side, notice that this is my right but your left, so pay attention to that whenever you look at a model or a patient or a person. Their right side is on your left, so you might work yourself around to being able to orient to the person's right or left, the anatomical right and left rather than your own. So anyway, right side of my chest, right lung is inside of the right pleural cavity. The left lung is inside of the left pleural cavity. Okay, so first in yellow we have the right pleural cavity, the right pleural cavity. And then next in yellow we will have the left pleural cavity, the left pleural cavity. Make sure you don't goof this up. Right and left are very important. You can imagine what would happen if somebody made a mistake and treated the wrong side of the body. So pay attention to right and left closely. And then the third cavity that we have within the chest is in the middle, kind of canted to the left a bit, and it contains the heart, and that's called the pericardial cavity. So here in yellow we have the pericardial cavity, the pericardial cavity. So let's do them all really quickly once again. The entire front cavity is called the ventral cavity. Up top we have the thoracic cavity containing the lungs and the heart. On the right side of the chest we have the right lung in its pleural cavity. Left side of the chest we have the left lung in its left pleural cavity. The heart sits in the pericardial cavity, and again all of that is inside of the thorax, the thoracic cavity. Below the diaphragm we have the abdominopelvic cavity. That's made up of the pelvic cavity and the abdominal cavity. Abdominal cavity is up here up above my belt, contains digestive organs, liver, and a few other organs. And then below my belt you could think of as having the pelvic cavity, containing the urinary bladder and reproductive organs. Alright, those are the cavities of the front of the body. One more area we should talk about, and that is we have a ventral cavity, we also have a dorsal cavity or a back cavity. That cavity actually contains the brain and the spinal cord. So dorsal cavity is made up of the cranial cavity where the brain sits and the spinal cavity down here where the spinal cord rests. So we've got the dorsal cavity being all the way down the back of the body. So here in yellow we have the dorsal cavity. The dorsal cavity. The dorsal cavity is subdivided into the cranial cavity where the brain sits and the spinal cavity where the spinal cord is. So first here in yellow we have the cranial cavity where the brain rests. And next we have the spinal cavity. The spinal cavity is where the spinal cord is. The spinal cavity. And I believe that's it. That makes up all of the cavities of the body. And I hope you learned something, and feel free to watch it again as many times as you want to or can tolerate. Thank you.